For me, it's been more getting to more patients and also dealing with the issues that are important to them, rather than us just telling them this is what you do and this is what's expected, but getting their point of view. I've got almost 400 children on my caseload. I do have to access quite a large number to make sure that they're well, that admissions are prevented or at least shortened. My contact with the new babies was probably 6-8 hours of home visit time, with one-to-one, meetings with parents to give them, information on the child's diagnosis, the background of the condition, how it could affect the children. And I usually would get about 24 new births in a year. So that's a lot of hours that I spend, and that sort of highlighted the fact that the older children and families that were struggling weren't getting the same support. I thought, okay, let me look at the caseload and let me see how I can manage it, look at the different pathways, how can I do it better. So with group consultation now, I bring in new babies, 5-year-olds, 3-year-olds, where parents have had different levels of, experience with sickle cell, and they're able to share. With this, I'm able to include like their OBS and look at their result, blood test results beforehand. So now I'm able to work with the consultant to say, yes, I saw so and so in group consultation. This was their presentation. Especially if they'd been in hospital, I can report back. So it gives some continuity as well.
I worked in a big tertiary hospital, so we could see like 80 children in a day, and each one went into a consultant for like 5-10 minutes, and it was in and out. Whereas here, I feel like we're getting to know the families, we're getting to know that they know how to manage their conditions better. So from that point of view, I think it's brilliant.
The quality of the interaction's better, because sometimes I go to the home and I have to draw the information out of them, but they seem to be prompted by one another in group consultation.
By senior consultants, you have a time limit for it to be seen, and everything is clinical. It's worth my time because this one is informal, and you can talk more and you can ask more questions and everything. Yeah, and get reassured.
From my experience, group consultation has given me better access, allowed me to deal with issues that are important to the client, and it helped encouraging families to make connections. Because sickle cell is a long-term condition, a lot of the families, even if they don't, or parents and the young children, even if they don't vocalize it, I know that they're isolated and feel isolated, like they're on their own. Nobody else goes through what they're going through. Nobody else understands. And a lot of the families struggle with the management, the need for antibiotics, the need for, a healthy diet, keeping warm and so on, the specifics of the care. And I feel like through group consultation and getting them to meet, we're beginning to address that. With the newer parents meeting more experienced parents, they get to see a bigger picture. So they know that, okay, my child's been well, but if I don't do what I need to do, he could get unwell. That's helped improve, their children's outcome. In terms of outcomes, from this, period that we've used group consultation, I've already observed less presentation to A&E. I feel a lot of the parents are reporting that they feel more confident in dealing with their children's crisis at the onset, whereas before they would always run to A&E instead of starting the management themselves, which is very important.
It will be really good with any other condition, because it will be nice seeing other parents who are going through the same thing and sharing ideas and seeing what they're going through and their difficulties.
I think we could use group consultation for other long-term conditions, with children, because parents would benefit from this, similar experiences of knowing that they're not on their own, adjusting to management, or, identifying problems that could happen.